Thank you, Sir Edward. It is a pleasure to serve under your chairmanship, and I'd firstly like to thank the Honourable Member for Blaydon for calling this debate. I'll say that at some point in all our lives, we will feel lonely. This may be for an endless number of reasons, but it's worth noting that loneliness is not the same as being alone. We could be surrounded by both friends and loved ones and still feel fundamentally lonely. The Covid-19 pandemic has had an undeniable impact on loneliness. A report by the British Red Cross found that almost 40% of UK adults are more concerned about their loneliness now than they were a year ago. And a similar number had gone more than a fortnight without having a meaningful conversation. Around 39% of UK adults say they do not think that their feelings of loneliness will go away after the coronavirus crisis is over. And a third say they are concerned about being able to connect with people in person in the way they did prior to the pandemic. Loneliness has long been thought of as an issue that most likely affects older people. And indeed, older people are hugely affected. Before the pandemic, an estimated 200,000 older people regularly went without having a conversation with a friend or a relative for over a month. However, as indicated by the Honourable Member for Southend West, loneliness can and does affect people of all ages. Young people aged between 18 and 24 years old consistently report higher levels of loneliness than any other age group. And over 11% of children are estimated to feel often lonely. During lockdown, our young people were isolated from their friends at school and university. Their prospects of starting new careers were dashed by many industries limiting staff numbers, and in particular hospitality, which as an industry is the largest employer of young people, was closed throughout lockdown. All of the data shows an alarming trend that the pandemic will have a long-lasting impact on the mental health of young people. I'd like to pledge my full support for a connected recovery. When emerging from this pandemic, we must ensure that nobody is excluded from our recovery. The only way in which we'll all recover is by connecting, reaching out, and ensuring no one is left behind. In April 2020, at the start of the national lockdown, the government launched a comprehensive plan to try and tackle loneliness. This included categorising loneliness as a priority of the £750 million charity funding package, continuing the Let's Talk Loneliness campaign, and bringing together a new Tackling Loneliness network made of private, public, and charity sector organisations who want to make a difference. Following this, the recommendation from the Red Cross that tackling loneliness should be built into all local authority COVID-19 recovery plans and integrated care system population health strategies would ensure that tackling loneliness is at the heart of the recovery. I'd like to thank the government for recognising the scale of the issue of loneliness and laying out plans to tackle it. I specifically want to commend them on attempting to tackle the taboo around the discussion of loneliness through the Let's Talk Loneliness campaign. It is my belief that this problem will not begin to be tackled until anyone without fear of judgment can reach out and say, I feel lonely. COVID-19 has also demonstrated how vital our digital infrastructure is. When families and friends could not be together in person, they could see each other online and still connect online. That is why I'm so glad the government has come together with the National Lottery for the Local Connections Fund. The funding will help to bring people together in safe and secure ways by covering the costs of technologies and equipment that will help people feel more connected within their communities. It is my hope this funding will begin to bridge the digital divide by building skills and confidence online. I've recently held a number of meetings with Wavelength, a charity who use technology to help those suffering from loneliness. I was delighted that just this week, wavelength, we're able to support multiple organisations in my constituency of Broxtowe. I'd like to once again thank the Honourable Member for Blaydon for calling this debate during Loneliness Awareness Week. I would like to end by thanking all those charities and organisations out there who are right now working tirelessly to help tackle loneliness. Groups such as Mind, Age UK, Samaritans, Re-Engage, Calm and the British Red Cross. All of these organisations help those dealing with loneliness, and I would encourage anyone listening today who is struggling to reach out to one of those groups. It is more important than ever that we connect with each other whilst emerging from this pandemic, and to ensure that we have a connected recovery, so that the message from the government coming out of this pandemic is that you are not alone. Thank you, Chairman.